it's so funny because nobody really, nurses that don't work in PACU never have a reason to go to PACU. Like, it's kind of a place that you've only heard of, and you can talk about it a lot. Like in post-op acute care units, you talk about PACU all the time, but we've never been. So, like, help me run through, like, what makes PACU, like, what are patient populations, and like, what does a typical day look like, type of shifts, all of that.
So yeah, I feel like nobody really knows where the PACU is, but a lot of people come from there. I wish we could have like a little, everybody gets a tour and gets a little like orientation to see what actually goes on, because it's a hub-in place. So where I work, we don't do any trauma, and we don't do any transplant surgeries. So we're doing adult and pediatric surgery, and then pretty much everything that's not trauma or transplant.
Yeah.
Because we don't do trauma, we don't have scheduled, nights, evenings. We do emergency surgeries, like appendectomies.
So like a lot of on-call.
Brains. Yes. So stuff like that throughout the night, but we don't have anything scheduled for like weekends, nights, that kind of thing.
Sure.
So a normal day is like you come in, we're staggered. There's no reason really for everybody to show up at the same time in the PACU, because everybody in our ORs starts around 7 or 7:30. That's when the surgeons are starting their surgeries, their first surgery of the day. So we kind of all come in staggered so that we're kind of timing right for when surgeries are coming out. We have 21 ORs, so there's probably like 10-ish nurses there a day. And it's kind of cool, but it can be a pain sometimes. But our start times are like we could come in at 7 or 7:30, 8, 8:30, 9, 10:30.
Yeah.
So that we have enough nurses by the time things are really flowing in a whole bunch of rooms. So all of the OR start at 7.
And you can get any type of, like, is there like designated areas, kind of like there's like special ORs for special,
Yep. There is. We have a cardiac suite, and we have a urology suite, and then everything else is kind of split up between there. So you could have GYN going in one room, laparoscopic, general surgery. We have cardiothoracic going in another room. But then for PACU nurse, I think of our charge nurse as a bit like a way harder version, but kind of like a hostess, as the charge nurse is there. Like,
the switchboard.
Hey, surgeon so-and-so just called out, and that's going to be your patient. So they're coming out to me. I look through their chart, their history and that kind of thing, and kind of prepare myself like you would on the floor, if you're getting a report from someone. And then they come to me, really like the handoff nurse is the nurse anesthetist. That's their patient. So we're working a lot with CRNAs. Those are probably like our closest person that we're working with is the CRNA. And then they also come out with their circulator nurse that was circulating in the OR.
Okay.
So they come and give us a little report, mostly really from the CRNA. They're talking about the anesthesia side, and then the circulator really covers the surgical side.
Sure.
And then we kind of get them hooked up to our monitors. Our unit is really unique. Actually, I don't know if our unit's really unique. I think it's unique is because we don't have any walls. So all of our patients are separated by curtains. It's kind of like bays.
Like
a older hospital. So it's kind of nice though. I think it's great. It really lends to a lot of like team nursing, and nurses, we're right next to each other like all the time. Yeah. So a lot of help. People are helping you get your patient settled in, and
that's good. Is it generally 1-to-1?
Yeah. So for an ICU patient, you're only going to have one. A pediatric patient, you only have one, and then anything besides that, you're maxed at 2. So they really treat it kind of like an ICU level of care. But that changes a little bit if your patient, for whatever reason has been there for a really long time, a couple hours, they kind of become like as if they're on the floor, like you're taking care of them up on the unit. But that's we max out for sure. One kid for sure, one ICU patient, which is really nice because, you start with one. If you end up with 2 patients, which happens, that's it. You're settled in, you have your people. So we're doing a lot of a lot of pain management. That's probably one of the biggest things we do. A lot of side effects of anesthesia. Drowsiness for one.
Yeah.
Trying to wake people up.
How long do people generally stay down there?
Honestly, it could be 30 minutes. It could be 2 hours. It could be 5 hours. They do a lot of different kinds of anesthesias too, which is, I really feel like a unique part of PACU nursing is you're really familiar with anesthesia and what the anesthesia team does. Anesthesia cocktail is really lots of medications and what they do and all that kind of thing. For like a MAC anesthesia, monitored anesthesia care, they could come out and be like, hey, my name's Cary and I just had, my feet worked on or whatever it is. Whereas like a general anesthesia they've been under for a couple hours could be a couple hours to get them to where they're really stable. We're really looking at that their pain is tolerable and that they're easily arousable. And
like oxygen sats.
Yes, that their oxygenation is normal. So normal vital signs, that kind of thing. But yeah, it's a lot shorter of an assessment than you would do on the floor. We're really looking at very specific things.
Right. Yeah.
So it can be really fast.